DKA. Let's do this. Let's do a quick overview of diabetes ketoacidosis, aka DKA.
DKA, what's going on first? What is DKA?
DKA is caused by extreme deficiency of insulin. This results in high blood sugar. DKA is mostly seen in people with type 1 diabetes. However, it can also occur in type 2 diabetes.
But nursing school usually just focus on type 1. What's happening in DKA? Because there is not enough insulin circulating, glucose cannot be properly utilized for energy. Remember the insulin hormone. Move glucose to the cell to be used as energy. Without insulin, this cannot happen.
In response, the body compensates by breaking down stored fats for energy. The fat then travels through the blood circulation to the liver, where they're broken down into ketone units. The ketone units then circulate into the bloodstream, where they are picked up by muscles and tissues. So this cycle continues, and fat cells continue to release fat into the circulation, and the liver continues to make more ketones and ketoacids.
This causes a rise in ketoacid levels, which causes the blood pH level to become acidatic. That is why these patients are always in a state of metabolic acidosis. Because of this metabolic state, patients will be breathing rapid, deep and rapid. We call this cosomal breathing.
This is a natural response of the body when it's in an acidatic state, as it's trying to get rid of that acid built up. Serum bicarb level will be low, usually less than 16 ml equivalent per liter, due to the hyperventilation.
Now you're going to have low electrolyte values, such as sodium, potassium. And once the ketoacidosis gets real bad, the reason for this is because of the acidatic state. The patients began to feel nauseous, and because of this constant nausea, they may vomit, and they are diuresing, so they are passing all these electrolytes out in urine.
So you're gonna have that, plus there's a shift as well in the electrolytes balance. Glucose level is usually at 300 mg per deciliter or greater, because there is an excess production of ketones. The patient will extract ketones in their urine. This is what we refer to as ketonuria. There is also a high level of ketones in the blood, as well because of the excess ketone. The patients will have a fruity smell to their breath, acetone breath.
DKA is a serious condition, and it proceeds rapidly. So we must be quick in our treatment. In DKA, the patient is severely dehydrated, and because of this, they are in a state of fluid imbalance. This is potentially life-threatening. So in DKA, the first thing as a nurse, you need to make sure that for therapy is established. So the patient must have for access. For access is important, as we need to begin fluid and electrolyte replacement therapy. The fluid therapy that is usually used is normal saline, and they normally run this at a higher rate because we want to make sure that the blood pressure is increased and urine output is at least 30 to 60 mL per hour. Now we have to be careful on how fast we are dropping these persons' blood sugar. So when the blood glucose levels approach at least 250 milligrams per deciliter, they usually had at least a 5% to 10% dextrose to prevent hypoglycemia and a sudden drop in the glucose, as cerebral edema can occur in this case. Another important thing for us to remember when treating DKA patient is to make sure we obtain a serum potassium level before we start insulin therapy. Now, if the patient is hypokalemic and we give insulin to them, this will further decrease their potassium levels. It is important for us to monitor their potassium levels. So initially, serum potassium levels may be normal or high. The levels can decrease rapidly once we start the insulin therapy, as insulin drives potassium into the cells, leading to life-threatening hypokalemia. So it is very important for us to monitor their potassium levels. It is important, as I mentioned earlier, to make sure that you are not dropping blood glucose level too rapidly, because this will cause cerebral edema.
So you need to be dropping or reducing the blood glucose, like 36 to at least 54 mg per deciliter per hour, and this will help us to avoid complications. Now remember, insulin allows the water and potassium to enter the cell along with glucose, and this can cause a depletion of vascular volume, as well as hypokalemia. So again, make sure that you are monitoring the patient's fluid balance as well as their potassium levels. Low potassium can be life-threatening, so this is very important on any exam that you're given.
So again, DKA, the patient is really dehydrated. So we need to be focusing on fluid replacement therapy, electrolyte therapy, and when we're given insulin, make sure that you are checking their potassium. Make sure that you are not reducing their blood glucose levels of more than 36 to 54 milligrams per deciliter per hour, as we are concerned about cerebral edema at this point. Hopefully you learned something from this, and I will see you soon.